Good afternoon, everyone. Thank you for joining me today. I'm Jennie Montgomery. Welcome to a special half hour dedicated to health concerns with two segments especially for women, ovarian cancer and PCOS. But first, something basic to men and women, sleep. If my family's watching right now, they're saying, hello, pot, meet kettle, as I read this. But even though I may struggle getting enough sleep, I do know that sleep is essential to good health. Signs of poor sleep quality include not feeling rested even after getting enough sleep, repeatedly waking up during the night, and experiencing symptoms of sleep disorders such as snoring or gasping for air. Sleep has become a luxury for some in an age of single parents, social media, and scrambled schedules. The number of people who suffer from inadequate sleep is significant and increasing, and that lack of sleep actually comes with a price tag. Researchers in Australia counted the cost of inadequate sleep from the health, safety, and decreased productivity perspectives. Costs related to doctor visits, car accidents, workplace injuries, days absent from work, and premature death were added up, making the estimated cost of inadequate sleep a whopping $45 billion. Jennie Norman breaks it down.
This equates to $6,117 for each person not sleeping enough in both financial and well-being costs. The cost of hospital care, doctors, medications, and tests alone, that was $1.24 billion, a large chunk of change. Of course, this is all an estimate, but inadequate sleep has a real association with many medical problems: heart failure, diabetes, stroke, and depression, and society pays a cost. At this Medical Minute, I'm Jennie Norman, ABC News.
And a local psychiatrist says risk of suicide can be added to that list too. Dr. Vaughn McCall is chairman of the Department of Psychiatry and Health Behavior at the Medical College of Georgia at Augusta University. Dr. McCall, thank you for being back today.
Thank you, Jennie. I always like being here.
Well, it's always good to have your perspective about these things. And, you know, 5 or 6 years ago, you published a study, and it was about people who lose hope of getting a good night's sleep and how that hopelessness can put them at risk for suicide.
Hopelessness is a classic risk factor for suicide. And when people feel very bad during the daytime and then get no relief from those depressed feelings at night, then they really feel at the end of their rope.
Yeah, because, you know, when you talk about depression, I think sleeping a lot is one of the symptoms of depression, which can be like an escape from it. And then if you're not sleeping, you don't have the escape.
That's exactly right. And either not getting enough sleep or sleeping too much, either one of these can be a sign of a psychiatric disorder.
Well, when you're going there with it, to me, it brings up this chicken, you know, what's first, the chicken or the egg? Is it the inadequate sleep that leads to depression, or is it depression that causes the inadequate sleep?
I think, again, the answer is yes. Both are true. And it raises an interesting possibility, which is this, that for psychiatric and mental disorders, we really have very little understanding about how to prevent them. But now we know that if you live with insomnia for a long enough period of time, you're at a 30-fold increased risk of developing depression. And so is it possible that simply addressing and effectively treating insomnia might reduce the possibility of ever having a depressive disorder? It's an interesting idea.
Your recent study that we're going to talk about today suggests that testing for obstructive sleep apnea should be part of the guidelines for treatment-resistant depression, if you're on depression and your medicines aren't helping.
That's correct. And when I'm working with my students, I tell them that our antidepressant medications are effective, but by this much. They're really only a little bit better than placebo. They're better and worth taking, but they're imperfect. And as a result of that, we know that patients oftentimes have to go through 2, sometimes 3 different medications before they find something that works for them.
Okay.
And by the time you get to your 2nd or 3rd medication, psychiatrists will often say this person now has entered so-called treatment-resistant depression. And the question is, well, why has this happened to this person? Should we take a step back and think, well, maybe we've missed the diagnosis. Maybe there's something else going on that's preventing them from responding to standard treatment. So we have a list of things to consider, and probably the most classic of these is thyroid disease. Could the patient have, in fact, thyroid disease, and that's mimicking depression or holding back their ability to respond to antidepressant medications? Now we know that obstructive sleep apnea is more common in depressed folk than in folks who don't have depression, and it's raised the question in my mind, shouldn't we now add obstructive sleep apnea to the list of things to consider when the patient's treatment course for depression isn't going well?
So someone who has been treated with different medications and therapy and whatever may turn out that they need a CPAP machine. And that could make a big difference.
It's possible, and the literature now says, for example, two things. First, that if you take folks who are depressed and have obstructive sleep apnea, that they're less likely to respond to standard antidepressants. But then if you subsequently treat the sleep apnea with a CPAP machine, the burden of depression symptoms goes down. So there's hope that in discovering sleep apnea and treating it, you can make a difference in so many things, but including the depression symptoms.
It's so important to study this, and you've studied so many different things and suicide risk in different populations. And as you know, September is Suicide Awareness Month, and we are making a big effort on this show to have one segment every week devoted to it. And so thank you for sharing with us this kind of a risk, and I hope that people are hearing it and they will talk to their doctors if they feel like they need to have a sleep study.
Right, well, thank you. It's an important topic.
All right, thank you so much. Coming up on Jennie, it's a reproductive disorder that affects 15% of women, and WJBF's Renetta Dubose is on the front lines raising awareness and fighting for funding from Congress. We'll hear from her about PCOS Day in D.C.